Welcome to USMLE The section we're going to talk about today is from First Aid for the USMLE Step 1, 2013 edition.
Page 282. Cardiac glycoside. Name a cardiac glycoside. Cardiac glycoside is digoxin. What is the pharmacokinetics and the pharmacodynamics of digoxin? The pharmacokinetics and the dynamics of digoxin is 75% it's bioavailable, 20 to 40% is protein bound. The half-life of digoxin is 40 hours, and it's urinarily excreted. The mechanism of action of digoxin is to directly inhibit the sodium-potassium ATPase, which leads to an indirect inhibition of the sodium-calcium exchanger or antiport. It will also lead to an increase in the levels of intracellular calcium, and this leads to positive inotropy. It also stimulates the vagus nerve, and this decreases the heart rate. What are some of the clinical uses of digoxin? Some of the clinical uses of the cardiac glycoside digoxin is for congestive heart failure, and in this it would increase contractility. It's also used in the treatment of atrial fibrillation to decrease the conduction of the AV node and to cause a depression of the SA node. What are some of the cholinergic side effects or toxicities that can happen with digoxin use? Some of the cholinergic effect that digoxin has are nausea, vomiting, diarrhea, and blurry yellow vision. To help you remember blurry yellow vision, just think of Van Gogh's famous painting, in which the painting does look a little blurry and it does have yellow coloring. What are some of the ECG changes that you can see in digoxin toxicity? Some of the ECG changes in digoxin toxicity includes an increase in the PR, decrease in the QT, and ST scooping. There would also be a T-wave inversion, arrhythmia, and AV block. One other thing to note here is that digoxin toxicity can also lead to hyperkalemia, which is a poor prognostic indicator. What are some of the factors that can predispose you to digoxin toxicity? Some of the factors include renal failure. In renal failure, there will be decrease in excretion of digoxin, therefore the likeliness of toxicity is increased. Also, hypokalemia can lead to digoxin toxicity. The reason for this is in hypokalemia, it gives digoxin the permission to bind at the potassium binding site on the sodium-potassium ATPase. And lastly, if you're using a drug like quinidine, it will also increase the chance of getting digoxin toxicity. The reason for this is quinidine decreases digoxin clearance. It also displaces digoxin from the tissue binding site, therefore it will cause an increase in toxicity levels of digoxin in the body. What is an antidote to reverse digoxin toxicity? An antidote to reverse digoxin toxicity is to slowly normalize the potassium. You could also give lidocaine, cardiac pacemakers, anti-digoxin fab fragments, and magnesium.
For more information on this topic, click on the link in the description section below. For a full USMLE Step 1 review, be sure to check us out at USMLEfasttrack.com, where we help you review the entire first aid for the USMLE Step 1 with high quality videos and hundreds of detailed pictures for a better understanding of the material. So to learn from the best USMLE review book, be sure to check us out at USMLEfasttrack.com.